Well, good afternoon, everybody. Thank you so much for joining us. Lucky, if you can turn on my video, I would appreciate it. Thank you. Okay, we'll start. He'll turn my video in a minute. I want to welcome everybody. My name is Angela Franco. I am the president and CEO of the DC Chamber of Commerce. I am delighted that you chose to be with us this afternoon to discuss these important issues facing DC businesses around how the public health crisis has and is currently impacting the behavioral health of our communities and workforce. But most importantly, as employers, how we can play a role in supporting employees during this time and as we think through return to work policies. Now I have my video. Thank you. We want you to know that the DC Chamber of Commerce is here to support and to be the best resource for you. As a membership organization, we welcome all businesses, large and small, and provide programs that will help them thrive and grow. The Chamber is committed to keeping our members updated on all the latest policies and major developments in our city and ensure your voices are represented so that business-friendly policies and legislation are adopted. An essential part of our mission is to connect our members in a variety of ways to provide continuing education on matters that impact your operations, such as COVID-19 response and reopening. Last year, we launched a survey with the support of DC Health to help employers assess whether they have implemented evidence-based health promotion interventions or strategies in their work sites to improve the health and well-being of their employees. Through follow-up focus groups and additional stakeholder conversations, we were able to gather data to produce a report on wellness programs in the workplace that is available today. It's on our website. And we are launching an initiative, DC Works Well, which will help DC employers improve their worksite wellness offerings. We believe that the employee's well-being is a critical factor, not only for the business success, for our community's success, for the success of our communities. Today's forum is one of a multi-part series of programs offered by the DC Chamber of Commerce each year. Additionally, we present quarterly employment law seminars, virtual trade economic missions. The next one is to Greece on May 19th. And we would like also to continue to build programs to expand business opportunities and training, like the PPP training that we have been doing to support small businesses in the district. Before I introduce our presenter for the afternoon, I want to thank our event sponsor, Care First, Brian Panic, Maria Tilden, and Colette Chichester. Thank you so much for your support and for your involvement and for the great conversations we had so far. In addition, I would like to thank our circle partners, the DC Health Benefit Exchange Authority, and our sponsors for your continued support and engagement. For sharing our sponsors. Thank you so much. Thank you. Now, I would like to welcome Dr. Barbara Bastron, Director of the DC Department of Behavioral Health. As Director, Dr. Bastron manages the district's recovery-oriented behavioral health system, Prior to her appointment as director, Dr. Basron served as deputy secretary to the Maryland Department of Health's Behavioral Health Administration. Dr. Basron also has clinical experience as a family therapist and received a Doctor of Philosophy from the University of Pittsburgh, her Master's of Education from the University of Cincinnati, and a Bachelor's of Arts from Oberlin College. Now, please help me in welcoming Dr. Basron.
Good afternoon, everyone, and thank you, Ms. Franco, and members of the Chamber for inviting me here today. It's really my pleasure to be with you to talk a little bit about the impact of the pandemic on the mental well-being of our residents within the District of Columbia. I would like to begin. I have a few slides that will be posted. If I can have the first slide, please. Okay, one of the things that I'd like to share with you is that there's been a lot of research regarding the impact of the pandemic on the mental well-being of all of the residents and citizens of the United States. And one of the things that we know is that businesses, especially small businesses, who have been impacted during this time really have to navigate the economic upheaval while trying to take care of their workforce, which is under more stress than ever before. According to a study that was conducted by the Kaiser Family Foundation, almost half of the adults within the United States indicated that they have been impacted by the pandemic in terms of their mental health status. And about 20% of them say that they have had a significant impact as a result of this. I think it is really important for us to focus on the fact, next slide, please, that some of the common concerns that people have is the status of their health and the health of their loved ones. We know that we're dealing with a contagious disease, and we know that we're just learning about the methods of transmission. And so that's been important. Safety, understanding the public health measures that will keep us safe. And people are concerned about whether they will work, whether others will actually implement them. And then the fear of potential loss of jobs. And as you know, within our community, many people have lost their jobs, and that has really impacted their financial status, their housing status, and every aspect of their life. And then managing family life while continuing to work. And this is particularly true of those who have children who are in school. So now parents are not only managing their family life, managing their work life, but they're also serving as teachers and educators to support virtual learning, and then being plugged in 24/7. And this is a result of the fact that we are now all connected like we are here today virtually, and people do stay online for many, many hours during a 24-hour period. Next slide, please. Now, in terms of really cultivating a healthy workplace culture, these are three of the key things and principles that employers might think about utilizing. One is voice. Erase the stigma of receiving mental health services by amplifying the resources that are available within your organization. Next, value. Promote the value of mental health to foster employee engagement. And this is really important, particularly as we are worried not only about mental health well-being, but about general productivity within the workplace. And then the third leg is vigilance, maximizing leadership potential with vigilance. From our own leadership position, making sure that we support the fact that people should get mental health when they need it, they should get valuable information, and they should protect their mental well-being. Next slide, please. One of the things that we do need to address are the health disparities issues and advancing health equity. What we know from the data that we've collected within the district is that 76% of all of the individuals who have died as a result of the pandemic have been Black or African American. We know that another 11% have been Hispanic or Latinx. 10% have been in the other non-Hispanic white population. 21 people, or 2%, have been in the other population, and Asians have represented 1%. And so there is a real disparity in terms of the people by racial category and ethnicity who have actually died as a result of this. And we do have to address that and understand that within the workplace. We do know that all of our employees will struggle with anxiety, depression, and burnout, trauma, and post-traumatic stress disorder as a result of this experience. And so we have to stay aware of that, but understand that there may be a differential response and a differential need based on one's race, culture, and ethnicity. Here within DBH, one of the things that we know is that the majority of our staff have continued to work on site throughout the pandemic. And then others have been able to telework. And we know that there are differences in some of the issues that we have to address in order to support mental wellness for those two groups. Some have not had the experience of being in the office. Others have been out there in the field the whole time, and that has made a big difference. I want to share with you, next slide, some of the tools to support employee well-being. One, I think the biggest one is we know that there is a lot of stigma around mental health, lots of stigma. And so one of the things that we need to do is normalize mental health challenges and really promote the coping techniques and strategies that will build resilience and allow people to function effectively within the community. The other thing that you can do is you can have a virtual therapist discuss symptoms, strategies, and ways of improving mental health and the availability of resources as a part of your routine meetings. And a lot of the employee assistance programs have those staff available, as well as there are others that I'll talk about to you later within the resources that we have. Modeling mental health behavior within your leadership role, and sharing with your employees how you're addressing your own mental wellness, how you're doing self-care, and what you're doing to do that. And also communicating consistently with employees. And this is a two-way situation, listening to their concerns, addressing them, being respectful about some of the fears that people bring, asking supervisors to really check in with the employees that are within their area of responsibility so that they can keep a pulse on their emotional wellness and their needs. And I think that this is really important because a variety of stressors are impacting emotional wellness. Some of it is their partner may have lost their job, their children may be returning to school for in-person learning, they may have lost somebody as a result of COVID, or may have experienced illness themselves. So please make sure that you make expectations clear about workload and flexible schedules. That's really important, particularly during this time period. And also just to make your team members aware of the mental health resources. And I'm going to share some of those with you today and encourage them to use them. Encourage them to get a checkup from the neck up. Encourage them to think about self-care, and then to show empathy and appreciation for what they are experiencing. A compliment and a kind word goes a long way. It may seem like a little thing, but it's really quite large. Next, please. The other thing that is important is to make sure that your employees are aware of the services and supports that you have available to them internally, and to strengthen those resources as needed. Most of our employers within our community offer health insurance. And so it's important to let staff know what the mental health benefits are that are included in their plan. And this includes any kind of mental health or counseling services that are available. Also, our EAP programs, our employee assistance programs, are often underutilized. Bring them into the fold. Engage the EAP clinicians so that they can provide both individual and group support for your employees. And then encourage wellness and exercise programs through your benefits. And we know that exercise really helps us in terms of our mental health status. And so this is something that we really should promote. Next slide, please. The other thing is just to adopt a universal approach to mental health. Promoting mental wellness. We got to normalize this. One of the things that has happened as a result of the pandemic is that mental health has been brought out of the shadows, and the stigma around receipt of mental health services has really reduced significantly. Because all of us are experiencing something. So please encourage your employees to, first of all, seek out information and access services and supports. It's important for them to maintain relationships and stay connected with people who they can share their experiences. The isolation that we have all experienced during the pandemic has been a major factor that has impacted our mental wellness. And we also would like to see mental health screening included in your primary care health benefit. Get that checkup from the neck up. This is one way of normalizing this process. And also to develop self-help resources that can help people develop effective coping strategies. And one of those is, for example, making sure that mental health first aid or psychological first aid is available to your supervisory staff as well as the other staff, so that they can identify signs and symptoms of individuals who may be in need of support. And then also to understand that people are under economic stress and distress. And our mayor has really highlighted a number of resources that are available to the business community that can help address this need. Next, please. If there is nothing you remember from my entire talk, please remember that we have a mental health hotline that is available 24/7 through the Department of Behavioral Health. Clinicians are available 24/7 around the clock. You don't need to make an appointment. You can get services immediately, and we offer 3 free individual appointments with a clinician with no need to register, to go through any screening process or anything. We tried to make this as low barrier as possible. So please, please share with your staff, and also utilize the mental health hotline number at 1-888-7-WE-HELP or 1-888-793-4357. We have, next slide, please, developed a series of partnerships with our resources within our community to address particularly the needs of not only frontline healthcare providers, but also our residents and employees in general through Howard University. And so these sessions are ongoing. They are virtual in nature, and I have provided the contact information there for you. These sessions really focus on building resilience, self-help, and support for mental wellness. We also are, next please, next slide please, next slide please. We also are lucky to have a partnership, if you can go back please, with the Wentz Center. I think most of you know the Wentz Center is noted for its services and supports around loss and healing. They are they address the trauma that is experienced as a result of all sorts of events. And that includes grief experiences as a result of the loss of a loved one, as well as other experiences such as those that we are all experiencing during the COVID timeframe. And they really focus on building resilience, helping people with mindfulness, and supporting all of the staff, including our employers during COVID. These sessions are free through the Department of Behavioral Health. They can do an individualized session for your team upon request, and they provide individual and group sessions for both adults as well as our children. So please, please, please note that. Next, please. We also have very quickly mounted a session. Go back one, please. There you are. Okay, for parents and families. We realize that parents are under great stress during this time for the reasons that I talked about before. And so we have developed Wellness Wednesdays, which is an online parent support group that is held at 5:30 every Wednesday and has been held every Wednesday since the beginning of the pandemic. It is held in English and in Spanish, and it discusses self-care, ways of managing the demands of parenting, how to work with your young person during distance learning, and the general impact on the family. One of the things we're seeing is that interfamily distress and stress is going up. And so Wellness Wednesdays is one of those things that I think would be helpful. You can access Wellness Wednesday by going to our website at dbh.dc.gov. We also, here again, our parents are invited to have the 3 free individualized consultation services and supports through our Access Helpline. And we have developed an on-demand library and with weekly parenting tips. And this is extremely important. It has a whole variety of tools. So if you can't meet that 5:30 timeline, you can do it at any time, day or night. And this is really to provide you information on social emotional development for your young person, and also how to manage your own stress and how to take care of yourself. We have put the link there for you. And so if you click on that link, you'll be able to access it. Next, please. Now, one of the things we know, next slide, please, is that the pandemic is not going to magically go away, nor the impacts of the pandemic. We're making great strides as we get more and more people vaccinated and we move towards herd immunity. You know, that vaccination piece is so important to all of our healthcare. The psychological impact of the pandemic, however, may last for either several months or up to 3 years, depending upon the individual. And so we have to be are really prepared to address the mental health impacts for the long term and over the long haul. We know that there may be an increase in the prevalence of issues, particularly among vulnerable populations and people who have risk factors. And I really want you to look at the list of people with risk factors. It includes not only those who've lost someone, but people who are suffered from misinformation. There was a lot of misinformation around the fact that the COVID virus was really not real, and that you really did need to protect yourself, and so on. And so some of that has caused some stress and distress. The loss of peer support because of school or work closures. We don't realize how important those connections are to our life until they are gone. The academic loss that our kids have experiences, medical comorbidities that have really made people at higher risk for death and also receiving the disease, and so on, burnout. And so you may see that people are more irritable. You may see that people are a little more depressed. You may see some other things. And so please be aware of all those factors. Next, please, as I move along fairly quickly. Here are some suggestions of the strategies that you can use on an ongoing basis. One of the things I strongly suggest is to invest in training, and particularly mental health first aid, because this will teach all of your staff how to identify the signs and symptoms of mental health, and then also how to know where to refer people for help, and then also some basic de-escalation strategies. Look at your policies and practices. How flexible are your hours, particularly when you have people who have young children who may not be back in school. And I think that this is important. Seek employee input. Listen to the voices in terms of what kind of supports would be useful. And then certainly building a culture of connection through check-ins, having your supervisors continue to check in with people, and really taking that pulse on a routine basis so that you know how really to develop strategies. And then lastly, next please. Last slide, please. Go back one, please. Okay, thank you. And so please, as my final words, anticipate and work to reduce stress and anxiety in the workplace. Encourage everybody to get vaccinated. Anyone above the age of 16 can have vaccine available. Establish that two-way communication and lead with empathy and understanding. Next slide, please. I'd like to thank you for inviting me. I am happy to take questions from you. And once again, be safe, mind your mental health, and please, please, please provide the resources needed for your staff. Thank you very much. Thank you, Mr. Franco, Ms. Franco. That concludes.
Thank you. So that's okay. Not a problem. Not a problem.
Okay. Thank you.
Thank you so much for joining us. We really enjoyed your presentation, and we're very, very grateful. And it was a pleasure to work with you during the transition.
Oh, thank you. Thank you.
Now, we would like to introduce Director Mila Kaufman. Mila is the director of the DC Health Benefit Exchange Authority. Mila, thank you so much for your support, for your partnership, and for joining us this afternoon.
All right, thank you so much. Thank you, Angela. And thank you, I should say, Angela, for your leadership as the president and CEO of the DC Chamber of Commerce, and for your strong partnership with DC HealthLink from day one. My name is Mila Kaufman, and I'm the Executive Director of the Health Benefit Exchange Authority. We're responsible for the Affordable Care Act online health insurance marketplace called DC HealthLink. More than 100,000 people get their private health insurance through DC HealthLink. We serve more than 5,100 district businesses and nonprofits, their employees, and district residents. We also cover approximately 10,000 congressional staff on the Hill and in district offices across the nation and members of Congress. Having successfully implemented the ACA here in DC, and together with Wayne Turnage, who you will hear from shortly, we've cut the uninsured rate by half. And now more than 96% of our population is insured. In fact, we rank number 2 behind Massachusetts for having the highest insured rate in the nation. Right now, we're implementing the COVID relief law, also known as the American Rescue Plan, in response to the devastating economic and health impacts of COVID-19. The American Rescue Plan reduces premiums for health insurance through DC HealthLink, provides health insurance for as little as $2 a month to people who lost their jobs, and pays for 100% of COBRA premiums for laid off workers. District residents covered through DC HealthLink will save approximately $36 million in premiums for individual and family health insurance this year. And we appreciate the close partnership we have with all the health plans and appreciate Care First's approach to supporting and quickly implementing the COVID relief law. Now, as we know, having health insurance is one of many important ways that employers support their workforce. Today's forum, Tools and Strategies for Supporting Workforce Wellbeing, will look beyond having good health insurance coverage. Today's forum is critical as we are preparing our teams for a transition to work and life after COVID. We're so fortunate to have a tremendous panel of experts. I will introduce each panel by name, title, and organization. I ask that you read their full bios. Wayne Turnage is the Deputy Mayor for Health and Human Services and the Director of the Department of Healthcare Finance. On a personal note, thank you, Deputy Mayor, for leading by modeling behavior. You participated in a vaccine trial and have been helping residents understand the importance of getting vaccinated. Lisa Brown Alexander is President and CEO of Nonprofit HR. Katie Horton is a research professor at the Department of Health Policy and Management at the George Washington University's Milken Institute School of Public Health. Catalina Sol is the Executive Director of La Clínica del Pueblo, a federally qualified health center serving the immigrant Latino community in and around Washington, D.C. David Bosvik is Vice President of Human Resources for Pepco Holdings and Exelon Utilities. And last but not least, moderating the panel is Brian Panic, President and CEO of Care First Blue Cross Blue Shield. Brian, thank you for your leadership at Care First, especially during the pandemic, and how quickly you pivoted to ensure that covered people got the care they needed. And as the pandemic exposed racism in healthcare, your leadership has been extraordinary, jumping in immediately to find ways to address the devastating impact of COVID in our communities of color. And now, on a slightly different note, George Floyd's murder trial verdict is being announced today. We know that many of our employees have been experiencing vicarious trauma and need our support now more than ever. And so today's session will help us all better support our workforce now and in the future. So now I would like to turn the mic over to you, Brian.
Thank you so much, Mila. I appreciate the introduction as well as the team's incredible work at the DC Health Benefit Exchange to support healthcare access, especially during this unprecedented pandemic. I don't think any of us could have imagined the investments that were made and how they would pay dividends during a time when it was so incredibly important to have access to healthcare for people in the community. So we appreciate your work there. I'd also like to thank Dr. Bazran for her insights and the actionable advice that we can all benefit from. I think this is going to be an important and timely conversation, and she did a fantastic job of kicking us off and really giving us something to think about, but also to implement as we come out of today's conversation. And so with that, good afternoon, friends and colleagues. CareFirst is excited to sponsor the DC Chamber of Commerce 2021 Health Policy Forum. We have been a longstanding member of the DC Chamber, and 2021 marks the 7th year that CareFirst has proudly sponsored this event. I'm personally honored to moderate this important panel discussion and urgently hopeful that we take away tools and strategies that can be put to immediate use for workforce well-being as we continue to navigate the pandemic and plan for the future. And I think, as Mila said, the reality that we bring ourselves to work and the intersection between our work and personal lives has never created more of a need to have this discussion and really to truly consider a whole person as employers and as people in the community and as leaders. For over 83 years, CareFirst has served communities in the District of Columbia, Maryland, and Northern Virginia as a not-for-profit healthcare company, providing a comprehensive portfolio of products and services. During the COVID-19 pandemic, CareFirst has been relentlessly committed to our mission to help the many people we serve throughout the region, individual members and employer groups, partners in the healthcare delivery systems, local and provider communities, community-based organizations, and our very own employees who live and work in our shared neighborhoods. At the onset of the pandemic, and as a large employer with a workforce of over 7,000 strong, we had to take swift action to significantly increase our associates' ability to work remotely and to ensure the health and safety of our associates whose jobs required them to be on site. I remember that day, March 12th of 2020, and bringing people home, sending people home, 95% of our workforce. And it was a pretty significant event for us and a substantial shift, not just in terms of business operation, but also culture and communication and leadership. And to date, we've been able to do that and secure the health and safety of our workers, but also for the folks that had to remain in the offices whose jobs really kept them in a physical location, that 5% of our workforce, to ensure that through social distancing and enhanced safety measures, that we've been able to keep them safe as well. And it's been a learning experience. We've learned a lot about ourselves, and we'll reflect on that as part of the panel discussion today. But humility has been a really important characteristic as we've come through these changes. Our plan included additional resources, including equipment and training for telework, and a stipend to help associates create a comfortable and productive work environment at home. As we all know, the pandemic has changed us in ways we never could have imagined. And while we've adapted, we have not been able to fully alleviate the feelings of stress or anxiety felt by so many. From the pressures of balancing work and personal demands, I can tell you I'm a father of 3 young daughters, ages 7, 4, and 2. So those challenges are real as you navigate work and schooling and childcare, to the impacts of sudden isolation and the daily struggles to stay connected to each other and maintain our health and well-being through new and shifting daily routines. These were significant shifts, not minor shifts, both personally and professionally. And so it only made sense that we would amplify the importance of prioritizing behavioral health as an essential part of practicing self-care and living life at our best for ourselves and for those we love. Unfortunately, seeking behavioral health services, as Dr. Bazran talked about earlier, is still too often shadowed by stigma and fear of judgment. As a society, we've not yet evolved to a place where we treat behavioral and physical health with equal importance, focus, and care. Self-care, but also clinical care when necessary and appropriate. So at CareFirst, we're making strides to bring light to these dark shadows by increasing awareness for and enhancing access to behavioral health services, especially during these extraordinarily difficult and uncertain times. So again, I'm incredibly excited to welcome and moderate the esteemed panel we have with us today. Let's go ahead and kick off what I know will be an enlightening and robust conversation. And I thought we would start with a perspective from the private sector and how our responsibility as businesses and leaders has changed and what we've observed. So Lisa and Catalina and David, I would love to hear from you first. What impact has the remote work environment had on the overall behavioral health and wellness of your workforces? And Lisa, do you want to get us started on that question and what you've observed?
Thanks so much, Brian. I really appreciate your comments, and thanks to Dr. Bazron for her remarks as well. I'm with Nonprofit HR, and we are a full service and for-profit consulting firm that consults to the nonprofit sector. Internally as a firm, we went through the same kind of experiences as others. And the impact on us has been really to force us to be even more agile than we were before. Obviously, no one anticipated March the 12th. It happened quickly. We were dispatched home and had to very quickly pivot how we supported our nonprofit clients, not only in the District of Columbia, but around the country. I will also say that we went through a period of time where I saw panic and stress across the faces and in the experiences of our staff. And so we were very intentional about bringing staff together on a regular basis using Zoom, of course. And we over communicated. We were overly nurturing. We were overly empathetic, if that's a thing, to ensure the safety and health of our staff. We saw fear. Our consultants were being asked to advise and consult to our clients. And so they had a double whammy, not only going through it personally, but needing to support clients professionally. And so for us, I would say it's been impactful, but thank goodness we're on the upswing.
Yeah, Lisa, that concept of over communicating really resonates with me, and we certainly found that to be critical. Catalina or David, do you want to weigh in here and provide some observations about what you saw within your workforce and some of the support that you offered?
Yes, hi, I'm Catalina Sol from La Clínica del Pueblo, and we're a nonprofit community clinic, a federally qualified health center here in DC. We're relatively small. We have about 120 employees, and many of our employees are of the same background as the community we serve, Latino immigrants. And so I think for us, it's very important to recognize that we're experiencing remote work in the context of the COVID pandemic. We had not previously experienced what telework might be, and experiencing the going to the remote environment under fear, distress, many of the same experiences that our patients were having with COVID, I think is a whole different ball game when we think about perhaps the future for telework. And the other dimension for us is that, of course, much of our workforce as a primary care clinic stayed on site. So for probably the first 6 months, and to some extent still today, we had a tale of two clinics, those that were providing services at home and those that were experiencing the stress and the fear of providing services on site. So I think in addition to the challenges of adapting new technology, new workflows, new ways of communicating, and the loss of the workplace, which is frequently the source of support and solidarity for any new experience, any personal distress, we also had the need to figure out how to continue to try to promote a culture of a single organization. I think that for us, the additional dimension of providing services to people who are on distress on the other line has created another layer of stress, anxiety, difficulty, burnout for our staff overall. And I think that one thing that I'd like to say is that there's 9 federally qualified health centers in the district. One of the areas that really helped us was to collaborate twice per week in conversations as to how we move forward in this time. Many of us have come up with the same strategies. Being able to provide flexible time off, and as much as we could to be able to support our staff to manage schedules while still trying to maintain essential services. Space for staff to be able to collectively discuss their experiences, not only with COVID, but the murder of George Floyd, the Capitol riots, many of the things that over this year have just caused additional traumatic events or re-triggering for many of our staff that come from experiences of trauma. And then as many staff supports as we could integrate in a time of revenue shortfalls, the appreciation, the recognitions. I also want to echo my thanks to Dr. Bazron's presentation, because she really said it all in terms of what we need to be able to provide, and it's very inspiring. So I'll stop there.
Yeah, I really appreciated your anecdote about the tale of two clinics. And while I recognize that was probably a real challenge as an employer, I know how deeply appreciative the community was for your frontline health support and for the folks that came in and provided those services, even in the midst of a pandemic. So thank you so much for that service, that continued service to the community. David, do you want to close us out here and provide a perspective?
Yeah, it sounds great. I had to switch computers. I was having trouble with my video, so thank you for your patience. Yeah, I also was, I want to echo what everybody said, and Dr. Bazin in particular, she really touched on a lot of the key points that all of us have to take into consideration. Obviously, Exelon Corporation and Pepco and Exelon Utilities is a for-profit company in the utility energy space. We, with 34,000 employees and 4,000 employees plus contractors, within the Pepco Holdings family, this has hit us pretty head on. And like many employers, like all of you, we have had to mobilize very quickly. For an organization that typically did not have at-home workers, we moved about 50% of our workforce home, which obviously for a company of our size created some upfront technical challenges because we never had that many people on a technology platform at once. But we got that taken care of pretty quickly. But we also had to be extremely nimble from an employee well-being perspective. We implemented a lot of new programs throughout the corporation, little things such as enhanced benefits. If we quarantined employees, we did not require them to take time out of their personal sick bank or out of their PTO bank. You could be quarantined for up to 14 days without it impacting you. And at that point, you would go into STD anyway. For those that were quarantined and or tested positive, which we have about 3,500 positive cases across our company, and another 550 or so contractors, we've returned to work about 3,700 of them. And for employees that we sent out on quarantine, again, trying to alleviate some of the daily pressures, we, while they're out on quarantine, provided them with meals for them and their families. So that would be taken off of their plate. But also rolled out a lot of concierge high touch services to our employees, both from a mental health perspective, from a physical health perspective, a lot of engagement related activities to really connect our leaders to our employees so that sense of isolation was minimized. Also due to the increase of social injustices and social inequities, we really launched a significant amount of virtual learnings for employees that have been very engaging. So just a lot of different things that I can go on for hours, but I'm sure some of this will come up through the course of the conversation. But we have been very good listeners to our employees and really rolled out a lot of new robust programs.
That's fantastic, David, and appreciate the amount of time and energy that went not just into business operations, but also the focus on people. And I love the fact that you talked about health equity. Every healthcare conversation needs to be a healthy equity conversation, and this is certainly no exception when we talk about mental health in the workplace. Let's shift gears and get a perspective from government. Deputy Mayor Turnage, you've got a unique responsibility, obviously, for the health of many district residents, and I know it's one that you take incredibly seriously. How would you describe the district's shift from accessing in-person health services as a result of the remote working environment to now accessing many of the same health services via telehealth? And Deputy Mayor, I think you might be on mute.
Can you hear me now?
Indeed, I can, sir.
First of all, good afternoon and good evening, everybody. It's a pleasure to be here. I would describe the shift as opportunistic. As payers, I will admit that we have historically been very suspicious or circumspect about the value of telehealth. The concern that we always have as payers is, are we going to get billed for a lot of services that really don't add value, that don't reflect the quality of care that beneficiaries should be receiving. And so for that reason, even though the technology was there, government has been somewhat slower to embrace telehealth. And when we did embrace it prior to the pandemic, it was in a very restrictive way. It could not be audio. It had to be at a designated site other than the home. So that kind of defeated the purpose for people who needed access to their physician because of conditions that made it difficult for them to get out of their home. And so we stuck with that, proudly ignorant that we were doing the right thing. And then when we were forced to re-examine this, and I can tell you, it was a one phone call that I received from a hospital CEO and also president of Howard, Dr. Frederick. He called me one evening during the second month of the pandemic, maybe it was the second or third, and he said that there had been a precipitous drop in their patient utilization levels. And this included patients that they were seeing on a regular basis for really chronic and serious illnesses. And the numbers that he read to me were just stunning. I just said, wow, I mean, are these people healthy now all of a sudden? He said, no, they're afraid to come out, understandably. And we are afraid that they're going to die at home because a lot of these are our patients that need regular care and attention. And so his call was was twofold. He wanted to know, what we were going to do about it, and two, he wanted to know if we could come up with some kind of payment enhancement to cover their revenue loss. But his big concern was, how can we put something in place to make sure that folks who need some attention are not putting their lives at risk by staying at home. So I spoke with my very excellent executive management team at DHCF, and we quickly, very quickly, pivoted to a more aggressive form of telehealth, even without CMS signing off on it. We had reason to believe that they would approve it. So we got rid of the distinction for the home. We got rid of the limitation of only visual telehealth. We allowed audio. And we saw in a period from, if you looked at the data in February, we had about 1,000 claims for telehealth for probably less than a couple of hundred people. You look now, 8, 9 months later, the growth has been phenomenal. 25,000 beneficiaries, well over 100,000 claims, and both the providers and the patients spoke volumes about the added value of that service. So that's kind of how we got there. It was first we were moved from our previous unwise position by the pandemic, and we were motivated to move, and then it was we normally may have faced some opposition by some members who may have been concerned about the cost, but because of the pandemic, we got no opposition and we were able to move forward very quickly.
Deputy Mayor, it sounds like you were taking many of the same calls from many of the same people that I was during that time early in the pandemic. And we were hearing and seeing movement of 10 to 20% utilization of telemedicine to north of 60 to 70% in some cases in primary care. Were you as surprised as I was at how quickly innovation and adoption spread through the healthcare delivery system and how quickly utilization went up? Was that, talk to me a bit about that. Yeah.
I was stunned, actually. And I'm not so much from the physician side, because I remember when I worked in Virginia, at the very beginnings of the telehealth technology, I was visiting University of Virginia Hospital, and they were showing us, now in retrospect, it was fairly clunky compared to what you can do now. And it seemed, and I was thinking at the time, well, this will never take off because people want to see their doctor. They want to press flesh. They want to make sure the doctor's not missing anything, and nobody's going to be satisfied with somebody looking at them on at that point, a really hazy TV screen, where you had, variable reception, particularly for people who were living in rural areas. So nobody's going to be satisfied with this. So when you fast forward 10 years later, and you fast forward to DC, and you look at the growth, and I was just stunned at the way the beneficiaries the enrollees grabbed it, because I thought they would be reluctant, even while staying at home. They would not trust a visit that was purely electronic. No way to talk to your physician beyond, a telephone or a computer. But they took to it very quickly, and it is something that we certainly will continue to push even after the pandemic.
Yeah, our sense is similar to yours, that it's here to stay, and that the utilization of telemedicine and alternate forms of medicine has been shifted permanently as a result of this. And while it may not remain at the levels that we saw at the height of the pandemic, it'll certainly be higher than when the pandemic started. So definitely appreciate those reflections, Deputy Mayor. Well, let's shift gears. We've heard a lot about change and the unprecedented amount of change that people have experienced personally and professionally, and not just pandemic related, but obviously what's happening in our society as a whole. And I would love to hear, Professor Horton, you talk a bit about, I saw the data that according to a recent Pew Research Center poll, 91% of adults have reported that their lives have changed at least somewhat since the beginning of the pandemic, while nearly half have said their lives have changed in major ways. We know these changes are particularly difficult for parents. What should employers know about the changes that parents have faced as people return to work, as we think about that transition period?
Thank you so much, Brian. And thanks to the DC Chamber for hosting today. Yeah, it's really amazing to see this dynamic. We know from the research that parents have actually experienced something called parental burnout. It's a chronic condition resulting from high levels of parenting-related stress. And this is all due to a mismatch between the demands that have been put on parents and the resources available to help them meet those demands. I think it's about 74 million kids under the age of 18. The majority live with parents who work outside the home. About 90% have at least one working parent, and about 60% have two working parents. We know that all of these families experience significant disruption in their daily schedules, their routines, their school schedules. So a real big problem. About a quarter of adults reported that at least one member of their household had lost their job or been laid off. About a third experienced reduced income. This is all particularly concerning, as over half report that they don't have emergency savings to cover even basic living expenses. So for parents who continue to work, over 1/3 report that they're struggling to handle childcare responsibilities. Real important factor for employers to recognize. So the pandemic's led to all of these big changes for almost all aspects of daily living, and many of these changes are consistent with the risk factors we know contribute to parental burnout. It's particularly troubling as parents experiencing parental burnout are really more likely to engage in child abuse, neglect. So these kinds of factors are really important to be aware of as your workforce returns.
And can you talk a bit about, Professor Horton, as you think about that, if there's one or two things that you think would be absolutely critical for leaders of business and government to know as they facilitate this transition, what would be one or two things you'd recommend that we implement or consider through that process?
Well, I think, absolutely a strong mental health package is part of your health benefits. There's just really important, strong importance of that, obviously. And then I think, there's this recognition of social determinants of health. These are the non-medical factors that contribute to someone's well-being. So acknowledging that caring for your workforce isn't just about the health care, the physical health of your employee, but really thinking more holistically about mental health, about those social determinants of health, transportation, financing, housing, all of these things that contribute to an employee's well-being. Those things are critical.
Yeah, I so appreciate that. And the conversation, the critical conversation about the trajectory of people's health and well-being and what informs that trajectory. And it's a great opportunity to segue into another area of intersection, which is really health disparities, which, we've talked about that the pandemic did not create inequity or disparity in healthcare, but it certainly exacerbated those issues. And I think from an opportunity perspective, what it's done is it's shown in full relief the reality of how deeply health disparities go in our healthcare system and in our society as a whole, and created much, much broader awareness for, I think, in the population at large than we've had in the past. Can you talk a bit about, what have you seen? What specifically have you seen exacerbated by the pandemic? And what are some areas of health and well-being that intersect with health disparities that you think are critical for us to consider?
Sure. So as you noted, health disparities always been with us. It's always affected employee well-being and workplace productivity well before the pandemic. We know chronic health problems impact businesses. We see absenteeism, turnover, costs associated with healthcare, workers' compensation, et cetera. But these historical challenges for diverse groups have only been exacerbated by COVID. These groups, including women, LGBTQ employees, people of color, also working parents, I just talked about. These are some of the groups having the hardest time both in the workplace and balancing that work and home life. So I think, particularly, we've talked a bit about the mental health impact and the need to have a strong mental health health insurance component. We've seen the numbers of substance use disorder and suicide increase dramatically. So I think I would note those as two particular areas for employers to think about outreach and making sure you've got strong support systems in place.
That's great. And David, one of the things we've talked about as we've worked to address vaccine hesitancy and vaccine education is the critical role that exists between employers and employees, the trust that exists there. Oftentimes, employers are the most trusting relationship a person might have in their life. When you think about health equity, and you mentioned it earlier, so I'd love for you to provide a little bit more information on this. What do you see as the role of the business sector in supporting and promoting health equity? What do you see as the opportunity there beyond just philanthropy, but as employers and as businesses and business leaders?
Yeah, I think from an internal workforce perspective, we've had to really demonstrate to our employees that we are committed to making sure that they have access to the vaccine. We have partnered with a number of providers, both at a national level and a local level, to make sure that the ease of administration is available to our employees so they can get, in many cases, vaccines at our work facilities. Or they can opt to have vaccines available to them, at a Walgreens or a place close to their home that's most convenient for them and for their family. We have also made sure that all of our employees are fully covered 100% to make sure that vaccine is available to them. We've also made sure that if an employee can get vaccinated during business hours, that we're paying them for that time. And if they have a reaction to their shot, that we pay them for an additional allotted period of time to recover from that as well, all outside of their day-to-day sick bank and PTO banks. Because again, we don't want our employees to feel like they're being punished by seeking the vaccine.
That's fantastic.
From an external perspective, you said exactly what we're doing. We're deeply involved in the community. We're talking to some partners right now that when vaccines do become readily available, that we will use our facilities as hubs in the community in which we can partner with them to administer the vaccines.
That's great. And with the broad availability of vaccines, I think a lot of us are beginning to turn our attention to what a new and better normal looks like. Lisa, if we could turn back to you, what do you see as some of the critical elements of developing a successful return to work plan? Professor Hurton provided some view. I'd love to get your view on this as an employer. What do you see in this space, and what would you recommend human resource professionals consider?
Yeah, thanks for the question, Brian. There are 4 things that I think organizations can do as they think through their return to work strategy. The first is to recognize that despite employees getting vaccinations, there is still a level of anxiety about coming into the physical workplace. People are still worried about their physical safety and the need for physical distancing. So if you haven't considered the physical layout of your workspace to ensure that people can be distanced, where people may have been kind of a cube away from each other, within coughing distance is another way to think of it. You might want to revisit your physical layout and consider alternating schedules so that staff can distance. And of course, if you are going to require staff to come back to the office, ensure that you have all of the safety and cleaning materials that they need to feel safe, right? Everybody might perhaps get a tube of wipes to wipe down their items in the physical workspace. You'll also want to, and many folks have talked about this already, the need for workplace flexibility has not ended. And when people return to the physical workplace, they're going to need it more than ever, because they'll then be navigating coming into the workplace, getting home, sometimes using alternative forms of transportation to ensure that their own physical safety. And so really relaxing your emphasis on policy and procedure is another key strategy for preparing for your return to work effort. It's also important to communicate with your staff that you're going to be embracing a new normal. And that means that people may be working different hours. They may need to make adjustments to their duties and responsibilities. You may need to consider, from a health equity perspective, the cost sharing model that you have for employees, and perhaps look at a new model based on salary or based on impact. And you know, typically in organizations, it's kind of a 70-30, 60-40 split between the employee and the employer. But now might be a good time, recognizing the financial impact of the pandemic on people, to look at other models that are perhaps equity-based models based on wages. And then fourthly, focus on workplace culture and positive employee engagement. That means if you know that there are elements of your organization that are particularly toxic, the tolerance for that toxicity is going down to about this, right? Because people have already experienced their own trauma. What they will not do is return to a workplace that re-traumatizes them for things that are, you know, kind of within the organization's control. And so for those of you who are CEOs and leaders on the call, I think there's some really important things you need to do with respect to culture, relaxing policy, ensuring that managers are trained to give and receive feedback effectively, emphasizing the need to be equitable and engaging and empathetic, as well as transparent, right? Be transparent about your own pressures as leaders, so that the staff in your organization can understand that you too have some anxiety about returning to the workplace, but together you can work through it. So those are just some of the strategies that I'd recommend if you're contemplating returning to work.
Yeah, I've never heard anyone else talk about it in terms of tolerance for toxicity, but it so resonates, Lisa, and it's like a raw nerve, right? That there's this nerve that's been exposed in all of us, and I think the care and attention that we need to provide, and the empathy and authenticity for people and culture has just never been greater. So really appreciate that. How about others on the panel? Anyone else want to weigh in on your thoughts on transition and communication through transition? Lisa, I think you hit a home run. So let's go ahead and pivot. And Catalina, I'd love to have you jump in here. So the current behavioral health crisis shed light on existing system gaps, such as the shortage of high quality behavioral health providers. And this is another area that as we think about what existed prior to the pandemic, we had a shortage of high quality behavioral health providers prior to the pandemic. It's not different now, although the demand and the need is greater. What kind of long-term policy solution can employers support to improve access to behavioral health services? What do you see as some of the keys to ensure that we connect adequate supply with this growing demand?
I think I'll speak here as a provider of behavioral health services to the essential workforce, right? So many of our mental health patients are members of the workforce who don't have insurance or have partial insurance that doesn't cover mental health services. And so our behavioral health staff is especially important in meeting our mission. And we've struggled over the decades of service in being able to ensure that we have a pipeline of bilingual, licensed therapists available to our community. And I think that this is now magnified, right? As the need for mental health services overall and their importance has been exacerbated by the pandemic. I think we have found supervision and mentorship to be really critical in being able to recruit younger mental health therapists who are in process of developing. That is a strategy that requires carved out time from seasoned therapists who have to give their quote non-productive time to be able to provide that kind of support, supervision, mentorship, and engagement for people to stay within and grow, within our organization. And I think this same culture of preventive mental health, supportive mental health in the workplace, particularly in one such as ours, which is also a caregiving workplace, requires us to think about what are the ways in which our model has to change to be able to value that non-productive time, right? So if we've been in a fee-for-service model for a long time, every minute of every provider that we have is valued for the service that they provide. But many of the things that we've talked about here that are strategies to be able to grow people or to keep them healthy so that they themselves can be good caregivers of patients or of others in the workplace require that non-productive time is the way that I think that we've been brought up to think of it. How do we transform our workplace with long-term policy solutions that allow us to, be able to provide that without not really being able to afford it? I think the other piece that I just want to highlight is that telemental health has worked for our clients who are essential workers. So I think a lot of us had some concerns that telemental health wasn't going to work. And to the contrary, our no-show rates have decreased. We have a higher demand. It has required a lot of extra time to be able to help our patients who don't speak English. The majority of our patients read through Zoom instructions, right? Zoom instructions are in English. So generally speaking, these technology options, if they're going to work for us on the other side of the digital divide, on the other side of the language access barrier, they have to be thought through with language access in mind. Certainly, telephone visits have been critical for us to be able to provide both mental health services and primary care services to our community. And then I'll just say, I think that generally working conditions are huge contributors towards mental health overall, right? So for us as an organization to have the benefits of paid sick leave and paid family leave that came through the COVID FFCRA law last year was very critical for us to be able to offer that flexibility as an employer. And I do think that we can't minimize the long-term policy solutions that are required to be able to address working conditions and working environments that allow workers to be able to take that without jeopardizing their employment and their livelihood. So that's what I had to contribute as thoughts.
Well, that's a lot. I mean, you covered an incredible amount of ground there and really important. I want to emphasize a couple of points that you made. You briefly touched on fee for service. I think we saw the limitations of fee for service with the challenges that you and the deputy mayor highlighted as we saw services reduced. Getting to the value orientation in healthcare is going to be absolutely critical for that new and better normal that we've talked about. And then I think you also highlighted a point that I just wanted to emphasize as well, which is that behavioral health access and healthcare equity requires digital equity and us to think differently about how people get connected to services. And so really critical points and appreciate your insights there. Deputy Mayor, I want to transition back to you. We touched on one of the most significant trends in telemedicine earlier at the outset of this conversation. I would love to get some more insight from you. What key trends do you see developing in the district that may impact healthcare going forward that have come out of this pandemic?
It's a very good question. I think that there are obviously I think the telemedicine will continue to ramp up. But I think there will be a more serious attention to ways to address the inequities in healthcare. As you noted, this particular virus was not the cause of the disparities, but it was opportunistic and taking advantage of them and killing a lot of people. Most people of color disproportionately. And I think what happened as a result is that, and it's not all provider-based. I think we do a disservice when we suggest that all of the inequities that we see in the community are based on the provider side. I think the exposure of so many minorities to this virus for environmental reasons that the provider has nothing to do with, will cause people to take a much broader look at what healthcare inequities or what health inequities mean. It's not just the relationship you have with your doctor, whether or not that doctor is respectful, whether or not that doctor understands that as an African American or a person of color, that you have been disproportionately impacted, but it's about whether the community at large deals with some of the underlying issues that have put people of color at a tremendous disadvantage when it comes to taking care of themselves. And it also, I think, that will reverberate through the healthcare community in terms of the policies you see, not just from the provider side, but also, the legislation or programs that you might see a council or a general assembly take up to maybe begin to place more serious attention on some of those environmental issues that drive healthcare inequities. But I think the other thing that it will do, and this is more of a hope than I wouldn't put a probability on it, but what I hope will happen is that people of color will pay more serious attention to their health. I am stunned when I talk with her. I grew up in a community, a predominantly Black working class community, went to an all Black high school. Most of my friends before I went to college, before I went to graduate school, college was all Black, predominantly all Black college. And so most of my friends until I hit graduate school were people of color like me. And a lot of us stay in contact. And I am stunned when I talk to at least half of them. And I asked them, when last you went to the doctor? They can't even remember. I said, when last time you had a physical? Never. And then I started getting judgmental. Then I realized I was 50 years old before I got my first physical that was non-sports related. I mean, I was 50 years old. And the only reason I got that physical, I was visiting the VCU health system, so a new wing they had put on with my boss then, Governor Warner. And he turned around, he said, Wayne, who is your doctor? And then I had said, I don't have one. and I was shamed. And the head of the health system basically said, okay, you're my patient from now on. And by the time I went to see him for my first physical, I was pre-diabetic, I was pre-hypertension, I had high cholesterol, and I was overweight. And I was 50 years old. I'd be dead now if that had not happened. And I think a lot of people of color are beginning to see that. It's not just the provider, it's not just what policy comes out of the General Assembly. We have to take better care of ourselves. And to do that, we have to educate ourselves. And then if we don't have the means, that's when we apply some pressure on the system to help folks who are in a situation where they want to help themselves, but it appears to be beyond their reach. So I think those are some of the things that I hope and I expect to come out of this transition from the pandemic.
Yeah, Deputy Mayor, and many of your hopes resonate personally with me. I guess my question for you would be: does it feel like the circumstances have shifted? My sense is that I've never seen this broad of recognition and acknowledgement given to systemic racism in healthcare in my career. And I've been at this for more than 20 years, and I've never seen this kind of comprehensive conversation. And I am hopeful that people will not allow themselves to unsee and unknow what we watched in full relief, and that we will act on the basis of what is clearly there and evident in the data. Is it your sense that we can pivot and get to that better normal? Are you hopeful that together we will push in this direction and begin to address these things permanently?
Yeah, I am very hopeful because of what you just said. I've not seen this level of activity around healthcare ever. It mirrors what we saw in the 60s with respect to civil rights. I mean, the clarion call from the community, the clarion demand from the community that you have to treat us with respect. We demand our civil rights. I think you're now seeing that not just on the community side, but also from the institutional side on the healthcare, for healthcare providers. So if it doesn't happen now, I don't know if it ever will happen. And so I expect it to happen. And this is, this pandemic has been an awful thing. Over 550-some thousand people are dead. I've heard numbers that had we done the right thing from a national leadership perspective, we probably would have lost less than 100,000 people. It has changed. It has, devastated economies. People have lost businesses, have lost jobs. We've seen the long food lines. So it's been an awful thing. but it is also, I think, given society a mirror to look at itself and say, it's up to you all to fix this. This is we just exposed the problem. Now you all have to fix it. And so I am hopeful, very hopeful.
A responsibility to act, and I'm even more hopeful having heard a lot of the reflections that we heard today from the panel.
Absolutely.
Deputy Mayor, I think we would do our audience a disservice if we didn't ask you about the district's response to the vaccination of district residents and how you're supporting that. And I think, frankly, what can we continue to do to ensure that we reach levels of immunity that will allow us to come into that better normal?
Yeah. Well, I'm somewhat biased because I've been a part of the response. I think the district's response has been outstanding. I've been working in both the private sector and now the public sector for almost 40 years. I didn't realize I was that old. And this has been one of the most greatest challenges that I've seen a government have to address. And when I looked at the response, the mayor basically with the first identified case in DC, from that day forward, the mayor put together a team of her senior staff. And I can tell you, we worked every day, 7 days a week. We were on calls with the mayor 3 times a day, 7 days a week. And we worked into the night, 7 days a week. It was, you didn't have time to be miserable. You didn't have time to be tired. And it wasn't just people sitting around talking. It was the most concerted effort to govern by metrics that I've seen since I've been working in government. We put together, based on the tremendous leadership of Dr. Nesbitt and her team, many of the mayor's senior staff, we identified the metrics that we wanted to measure our response by. And we used over 10, we had more than 14 or 15 metrics, but we had at least 10 where we decided we would assiduously follow those metrics and use it as a guide for turning the knob on the economy and of DC, turn that knob either more open or more closed. And I have never seen a group of people with such discipline facing a lot of criticism from people who felt we were being too restrictive. The mayor was I'm sure she was getting hammered in private phone calls. People like, you need to open up. We don't see the problems that you see. We think we need to be open. But we were looking at metrics on daily case rate of transmission, test positivity rate, the new cases that came from quarantine contacts. We looked at hospital utilization. We looked at our testing. And if we didn't see the right values in the majority of those metrics, the economy stayed closed. And it was, and it continues to be such a tremendous exercise and remarkable leadership by the mayor, and amazing discipline by the folks that work around her, and just the tremendous dedication. I have not seen anything like that, as I said, in my almost 40 years of work. So I will remember that for a very long time. And so in terms of what needs to be done going forward, we need the help of, we took a whole of government approach to trying to attack this problem. Now we need a whole of community approach to drive home the message. People must get vaccinated. They must get vaccinated. The vaccine hesitancy is real. And I will tell you, I won't mention the agency because I don't, but we have people in government who are around us every day who refuse to get vaccinated. And we learned that 3 of our employees just this week have ended up in the hospital. These first responders have ended up in the hospital, and one is very critical because they got affected with COVID. They have a high-risk job, but they refuse to get vaccinated. And so it is an imperative that whatever organization that you run, you must drive home the fact that the safest way to beat this vaccine, to beat this virus, is through vaccination. And if we don't accomplish that, we'll be fighting. This thing will be with us for a while anyway, but it can be with us as nothing more than the flu, or it can be still killing people, disproportionately minorities, and killing more people than you would expect it to see for the next 10 years if we don't get people vaccinated. So that is what I would hope, that credible messaging, through pressure. And, I'm not opposed to mandates. I know that there's a thought out there that says, because this is an emergency use vaccine, you can't mandate it. I don't believe that. I'm not a lawyer. But my view is, if you can find any basis to mandate it, you mandate it and make people challenge it, because this is too serious of an issue to have people come to high-risk work environments without vaccines and putting other people's lives in danger and putting themselves in danger. So that is my hope, that that this community, as well as this nation, will rally around the effort to get everybody vaccinated. We need at least 80% of this population vaccinated. And right now we have, half of all adults have at least one shot. We need that number to get up to 80, 90%.
Deputy Mayor, we're going to close on your urgent call to action, which I think is about the most important thing we could focus on coming out of today's panel. I want to thank the other panelists. I think an outstanding job and great insights from all. And I'll just share, Deputy Mayor, having seen this all over the country, I share your sentiments that I think the mayor has done a phenomenal job being driven by data and science, and how responsive and collaborative this effort has been. So share your view, and as well as your appreciation for the mayor's work on this. With that, I'd like to turn it back to Angela Franco to close us out today.
Thank you so much. What a great, wonderful panel. I mean, what information. I mean, count on the DC Chamber to be a partner, to work with you, to spread the word, and to be an example, more than anything, to be an example. I think that internally in our chamber, we always check on our health, on our mental health, and I try to be, as a leader, as transparent as possible. Like Lisa was saying, sometimes we don't feel well, sometimes we feel great, but it's important that we all see that we're not perfect, and we're going through some situations. To Brian, to you and Blue Cross, thank you so much for your support. It was just a wonderful, really wonderful panel this afternoon. To all the participants, thank you. I also want to acknowledge our chairwoman of the board, Carolyn Rudd, that participated the whole forum. And I want to invite you all to our Small Business Summit that is May 7th. You can register at the website. And again, to all the panelists, Deputy Mayor, to Brian and all the speakers, I really thank you from the bottom of my heart, and for this great information and for your participation this afternoon. Great. Thank you so much, Brian.
Thanks, Angela. It was great to be here.
Yes, it was what a wonderful conversation.
Yeah, it was a fantastic group. So I think really insightful and really helpful for the audience today.
Mm-hmm.
Thank you so much, Angela. I really, really enjoyed it. Thank you so much for inviting me. And
Hi,
it was wonderful to
thank
be
you
with
for
all the
joining us.
See? All right.
Wonderful. We have to be inclusive in everything we do.
Great. Wonderful. Thank you.
Okay.
Nice to meet you. Bye.
Bye-bye.